All right, everybody, welcome to this live edition of The Compliance Guy. As always, I want to say thank you so much for tuning in, logging on, and just hanging out with me and my special guest as we get an opportunity to talk about the latest, greatest in healthcare, regulatory compliance, the business of medicine, and really the intersection of where the business of medicine and compliance intersect. Today, I'm really excited to have this individual on the program with me today. Her name is Elizabeth Johnson. She's got a really fascinating story, and she's the co-founder and president of the National Association of Medication Access and Patient Advocacy. And we've kind of been chuckling a little bit prior to getting started because apparently there's a blooper reel of people trying to pronounce their acronyms. So I'm just going to say NAMAPA.
And you got it.
Oh, so I got it. All right. Good deal. And Elizabeth is also the chief executive officer for Medeco CX, which is a group of independent specialists unified by patient-centric access to biologics. Elizabeth is a licensed a practical nurse with a rich background in patient care. You know, I could go on and on and on, but what I'd really rather do is have Elizabeth really kind of tell us about herself and tell us about NAMAPA and help our listeners, our viewers, really get an opportunity to understand what this great organization does. And before you get started, I just wanted to surprise you and let you know that I have made your charity my official charity on Amazon.
Thank you. That's fantastic.
I have. I've been with Alex's lemonade stand for a lot of years, and my wife, Jill, who is addicted to Amazon, helps to ensure that a nice amount of donations gets made on our behalf every quarter. So
great. Now, woman after my own heart.
Yeah. So now, hopefully y'all will start to see something coming in from us on those quarterly donations through making you our preferred charity on Amazon. So for anybody who's out there listening and tuning in to us right now or on the recorded version, if you're listening at a later date and time, you can work with NAMAPA and Amazon to make them your official charity. And I think it's going to go to a wonderful cause. So Elizabeth, welcome to the program. Thanks so much for being here today. You're a lady after my own heart in a hoodie. I was thinking about putting the baseball hat on, and it's so cold. I didn't want to get out of my chair. So I'm just going to have to go with the big forehead this morning. So welcome to the show, and thanks for being here.
Hey, Sean, I really appreciate it. And the first time we chatted, I think you had just come in from outside and had a ball cap on. So I was going with history here. So yeah, thank you. Again, this is great. And what a great surprise on a Monday about the Amazon charity. The best thing Amazon did was put their Smile account through their app. So now it's all together. But yeah, a little bit about me. So interesting start. My family is in medicine or law, kind of your choice. So I chose the medicine route. I became a nurse and thought I was going to be an adrenaline junkie and work ER, ICU, something fancy. And then I realized I had a small child at the time that maybe private practice was kind of my wheelhouse. So found a job posting on Craigslist of all places and applied. And I was like, oh, allergy? Okay, this sounds fine. And so I've been in the allergy and immunology field for a little over 10 years. Dabbled in infectious disease for 3 of those as well. Great overlap there. But the one thing that I focused on through that whole part was specialty medications, injectables and infusion drugs. And what always was shocking to me is that access is access, right? We're all fighting the same pharmacies. We're all fighting the same payers. But we get so siloed by our specialty. And allergy is kind of newer to the biologics ballgame, the buy and bill, the access piece. And I didn't really have anybody to talk to. I had great manufacturer partners. I had great field reimbursement managers. But, sometimes you just want to have that phone a friend that you can ask, hey, have you done this? What did you do? How can you help me? So through that, I finally met my people, finally met others that were going through the same thing I was in other fields, and we came together. And we would talk about, I have a great text chain. Hey, I need this drug. How do you get it? Where do you get it from? And I thought that was a great idea. Like, hey, I have these resources. And so on a flight back, a friend and I were, having a beverage on our flight. We'd done a successful talk. And she was like, what do you want to do in 5 years? I mean, because that's what you talk about on a flight. But
Sure.
it came out from both of us that we both wanted to do a nonprofit. We wanted to give back to a very specific group of people who I think oftentimes are just under recognized. They're just kind of taken as like, yeah, they're part of the healthcare system, good for them. And it's these biologics coordinators, financial navigators, financial counselors. There's a million names. But really what it is, it's the person working between the physician and the patient. It's that access person. And so that is how NAMAPA was born, in that we wanted to close that gap between specialties. So we're non-therapeutic specific, and give back. What works for me in allergy might work for them in oncology or rheumatology. And so it's really just bridging that gap and creating that very, very large phone a friend network.
So it's really, you're building a coalition, right? And
Yeah.
and I think that's what's needed right now. We hear the conversations all the time coming out of DC and coming out of our politicians' mouths talking about controlling the costs of medications. Problem is you can't control the cost of medications when you're meeting with the special interest groups and the lobbyist groups that are paying for these nice lunches and dinners and nice trips and things of that nature, right? And it sounds really good on a stump campaign, right? It sounds really good as your platform. I'm going to fight to reduce the cost of medications. And as a prime example, over this past weekend, because I just don't have anything better to do with my life than to read what's going on in the world of healthcare. I was talking to our mutual friend Jordan Johnson, and we were talking about the fact that this guy never sleeps. And I think he called me at like 7 o'clock in the morning, my time. So 6 o'clock his time. He was in Texas.
Yep.
And, we got into a conversation about the increase of 14.5% across the board in Medicare premiums in 2022. Forget about the deductible for just a moment, but a 14.5% increase to Medicare premiums. And a lot of people were pointing to an Alzheimer's drug that many people out there, many physicians I've talked to already have said doesn't work. Others have said, and again, I'm not a clinician, so I can't speak to the efficacy, but many have said it doesn't work at this point, or there's just not enough clinical information to be able to determine whether it's effective or not. But that's what's driving the cost. Now, anybody with half a brain knows that it's not just tied to a medication that's being taken by a limited number of people. There's a lot of other factors. But that's a prime example of where in the neurosciences community, if they're not collaborating or part of your coalition, they could be missing out potentially on an opportunity to get into a network where maybe on their own, they don't have that power to be able to engage in these high level conversations, but through a nonprofit organization like yours, they start to get that momentum behind them and they start to get some of that backing. Is that a fair way to describe it?
Yeah, it is. And I kind of tie this into every year around the first of the year, there's always something that we have to pay attention to. I spent the first 6 months of this year talking about Most Favored Nation. I'm sure you remember when that came out and changing prices of drugs. And there's also a push to reduce Part B spending on drugs again. And it comes down to kind of the same reason that we fight for these people as well, right? We fight for education, but we also fight for value in what they bring. Access is tough, right? Texas has the gold card going on right now to reduce and remove prior authorization.
That's
well,
right.
What's going to happen? On the back end, you're going to have claims get held. You're going to have more skilled billers and coders to be able to answer denials or request more info. So flip that back. If we start changing cost of drug and start changing this and rebates and so on and so forth, how do we value those people in access? We're not making their job easier, but we're cutting spending and reimbursement, increasing it on the patient's end. So they're working harder to go to foundations. I could just go on and on about this chain reaction that these things cause outside of, let's start with the patient. That sucks for them. Then are we going to have foundations open to cover these things for them? And it just trickles. So I have a feeling the first 6 months of 2022 is going to be spent a lot on foundation coverage and support for patients.
I agree with you wholeheartedly. So there's a couple of things that you mentioned that I want to make sure that for our listeners and viewers that we kind of address those, right? So the first thing that you brought up was most favored nations clause, right? And
Correct.
Traditionally, and help me because I am not as adept to the understanding of a most favored nations clause unless it transitions the same way from the kind of work that I do to what you're doing. Basically, what a most favored nations clause says is that if you engage in a contract with an insurance company at this rate today, and then you enter into a contract tomorrow with insurance company B at a rate lower than what you negotiated with that first entity, they have the right to drop your reimbursement to your lowest payer's negotiated amount. So in pharmaceuticals, how does the most favored nations clause work? Is there some similarity on the discount aspect to that for you guys, or how does that work?
So what that was, and it was actually put to rest later on in this year, what it was doing was comparing the cost of drug in the U.S. to drug in other countries. And if we were to source medication elsewhere, we should be reimbursed based on that rate of purchasing versus what we are paying here. And so, of course, everyone up in arms because of research and development, so on and so forth.
Right.
But it drastically cut reimbursement.
So it is the same thing. It is the same thing. Yours is just tied to the cost associated with buying the drugs from Canada, as an example.
Correct.
And if the cost of the drug in Canada is $20 less than the cost here, then they're going to reimburse you based on that average wholesale price, that AWP from Canada.
Correct.
Got it. The second thing that you brought up, and you're the second person who's actually brought up the gold card. Had a conversation with the executive director for the Medical Association of Tennessee not too long ago. Outstanding lady. I think Tennessee is really doing some amazing work. But the state of Texas has really taken a lead on this gold card, from what I understand. And the gold card, for our listeners and viewers, what it basically does is the insurance companies in that state will, if you achieve a 90% or higher pre-authorization on drugs, supplies, surgeries, services that require pre-authorizations, they will issue you a gold card. And that gold card has a list of all of those services and or supplies or biologics that you have achieved a 90% pre-authorization on, that now you don't have to sit on the phone for 4.5 hours trying to get a pre-authorization. And that's sort of what the gold card, as it was explained to me. Is that what's working in the pharmaceutical world as well, getting these pre-authorizations?
Yeah, you said 4.5 hours. That's really short. I think the American Medical Association says 9. So, yeah, it really comes down to that. And you have to have a gold card from each payer, right? It's not just you get this blanket free pass.
That's right.
And so I find that really interesting. And I think it's a good idea, right? That would pre-auth is a lot of time. It's very consuming. First of all, we're saying pre-auth. Blue Cross of Texas loves predeterminations. So it's a different format. That's usually a written format, and it has to be submitted by fax or mail. So no electronic submission there. So I think that's great that they're trying to do that, but it kind of worries me because other payers have, especially in my small world of biologics, right? other payers have stopped asking for pre-service review, and they are holding claims on the back end, and they want medical records, so on and so forth. So I'm really curious how this gold card plays out, because where's the time going to be spent, pre or post treatment? Well, I teach do everything pre-treatment to protect the patient, but we'll see. We'll see.
Yeah, this is the thing about healthcare, right? You can't ever just sit back and think that what you have right now is what you're going to be dealing with tomorrow, because everything continues to change so rapidly in this industry. And, again, I'm so fascinated with what NAMAPA is doing. So tell us a little bit more about how your advocacy program works, how you get people involved, and, really what your end goal is on this thing.
Sure. So where we started was, let's give tips, tricks, and a community sense to these individuals. And we call them healthcare advocates, because we've actually taken a little bit of a beating by trying to say patient advocacy. There are private patient groups that advocate for their disease state, which I love and support, and I think that's awesome. So we've kind of changed the name a little bit to try to define what an advocate is for us. And so healthcare advocate is where we've landed. And that can be anyone on the healthcare team, right? I think that front desk admin type roles are just as valuable. They're the front line to the patient. So what we do is provide, and right now it's the end of the year, so I'll kind of concentrate on that education, but how to set yourself up for a better January 1st, how to make sure that no patient falls through the crack, how to make sure you've done inventory, brought your staff in, you have a plan for benefits and who's checking what. The last thing we want is you rearranging your schedules to pay Medicare patients first. We'll get to commercial later because they require more work. We want everybody to come in as it's needed. So we're spending a lot of time creating checklists. We've got a whole guide you can download on our website that's applicable from private practice to hospitals. Access is access. And we also had earlier this year, we were the presenting sponsor for a conference called the Healthcare Advocate Summit, where we brought healthcare advocates together. And it was the first event, which was great. We loved it. It was in Texas. And we left with everyone saying we want more. So both constructive and positive is how I take that, is we need to bring more. So we're looking to also be a sponsor for that as well next year and bring more information to the table. Right now, we're kind of on track to split it two ways. We're going to do a UBO4 and a CMS 1500 track.
Oh, so, good. I think that will attract even more people, right? Because now you can focus on the facility side as opposed to just focusing on the community physician practices.
Yeah, absolutely. I think it's needed, and I think cross collaboration is needed, because there's different sides to pharma that calls on those different entities. So let's bring all of our partners together and chat about it. So the kind of end goal for NAMAPA really is to grow in members. So we do have the ability to have a paid membership, and there's additional content and resources behind that. We're trying to develop a mentor program, right? So you can have a direct person that you talk to be your resource, especially in the career kind of development. Maybe you're a financial counselor, but you want to get into a field reimbursement role. How do you make that transition over to the pharmaceutical side? So we're trying to be all things medication access. It's a lot to bite off, but so far so good.
I was looking, one of the things that I thought, I always look for these things to inspire me, right? Because doing the kind of work that I do on a day in and day out basis, there's a lot of excitement to it. There's a lot of different things, but there's a lot of monotony, right? And I'm always looking for things to inspire me. And I was looking at what an advocate is, right? And the third item on your advocacy list is the one that kind of caught my attention, right? And it says an advocate can be told no 300 times, and even after that 300th no, it is just another starting point to ask a payer or insurance provider what they need to do or who they need to speak with to help their patient. Yep. I think that one to me And I mean, all seven of the bullets that you have under advocate, they're all important, and they all speak to a certain aspect. But that one was the one that really kind of stuck out to me, right? Because that's the one, because oftentimes during the day when I'm in negotiations on behalf of a client for something with a governmental agency or a commercial payer, and they tell me no, and then I go back and I offer something else and they tell me no again, and I
Yeah.
start to get a little irritated. I need to kind of look at this one and say, okay, maybe it's going to take 300 times. I hope not, because
Yeah, we all hope it doesn't take that many times.
that's a lot. But just the meaning itself, which is basically, just because somebody tells you no doesn't mean that you have to accept that as the final answer. Go back, find resources, find information that can be beneficial to help push this forward, to get them to say yes. I think is the point that this is trying to make, which is, we're advocating on behalf of the people who need it most, right? We're giving a
Yeah.
voice to those who don't have a voice.
And that leads into a lot of our teaching and what we talk about there. I always make the joke that by doing this job, I have a great marriage because I get to argue with someone else all day long, so that by the time I get to my husband, I'm not argumentative anymore. Yeah, it's kind of true.
Can my wife come to work with you?
Yeah, let me have her for a day. We'll chat. But I kind of also go back to, I was kind of a rebellious teenager, right? I gave my parents a run for their money, and for better or for worse, that's really helped me in my job now. And when I'm told no, when I'm told we don't do that or that's not possible, my first, why? Why is it not? Tell me where in your policies, tell me where in any procedure that you have that I can't do this or cannot access this for my patient. So it's kind of one of those almost scratching off, can't do this, can't do this. All right, I'm going to this. And I've been really blessed to work on some very difficult cases. And I say blessed because they were great learning examples. I mean, some taking over a year to get access for a patient.
Can we talk about a couple of those?
Yeah, sure. So I've worked with a patient on the chemotherapy side, trying to get oncology products for that patient. And it took 13 months to get a certain medication approved for them. And that's just insane to me. 13 months for something, for whether I had to go compassionate use, which is a whole nother story of how to get.
Can you talk a little bit about compassionate use and why you do that? I'm sorry, you're in a hoodie, so.
Yeah, there we go. Now I feel better. Thanks.
Now you feel good, right?
Now I feel like this is just a fireside chat,
It only took me 22 minutes to get this thing out, and you know what?
Did your heater finally kick on? Is that why?
Yeah, it did get a little bit warm in here, and we were kind of talking before we got kicked off that it is a little bit chilly out, and me being on this Brilinta, these blood thinners, man, it thins you out quick, and
yeah,
this thing now is getting a little bit warm, but let's.
When your wife and I hang out and work together for a day, I'm gonna tell her what great Christmas sweater to get you. Is what's gonna happen.
Okay, so can I share something with you and everybody who's listening? My wife, if Jill's listening to this, she's probably going to be like, "Don't do it." We got this thing called a comfy.
Have not heard of it.
Okay, so you know what the Snuggie is, right?
I remember those. Oh yeah.
Okay, so they've come out with something new and improved.
Oh no.
It's called the comfy.
Let me take note of that.
And
okay.
I got one in camouflage.
So it's very you, okay?
Yeah, very me, right? Much like Jordan, I'm a Southern guy, and we hang out on our farms and we ride our tractors and we wear camo and all that stuff that
Yeah, I think Jill is listening.
There it is. But yeah, that thing is like a weighted blanket, and it's just really super comfortable. That's why they call it the comfy.
Hey, listen, Jordan Johnson being a friend of mine, The way speaking of compassionate use, the way I
Yeah.
butter him up to continue.
Yeah. Let's get off the comfy and let's get into compassionate use.
So I sent him a snack box not long ago from Amazon that arrived with like 50 different snacks in it. So I'm gonna have to send him this camo comfy thing. So
I'm telling
Merry
you.
Christmas, Jordan.
Yeah, my wife. I got to tell you, my wife got hers first. It came in pink, and you know, I'm comfortable with who I am, and I was like, I got to try this thing on, and I was like counting down the days until mine came. I was like, oh my god, this is so unfair, and it got cold, and I was like, I really need this thing. And Jill's like, if you dare wear that out, I was like, oh, it's like a sweatshirt. She's like, you wear that thing out of the house, we're done.
Pro tip of the Snuggie was you just turned it around backwards and it was a robe, so you got two uses out of one thing. So
that's good. So let's talk about compassionate use.
Yeah. So compassionate use was new to me. I was not aware when I first started in advocacy or working with patients that was a thing. And I happened to catch a little tiny fine print somewhere on a manufacturer website that said if you are struggling with this or this off-label use, you can apply for compassionate use. So me being the Google expert that I feel healthcare has made me, I Googled what it was and looked up for the specific manufacturer that I was with or working with at the time, how to do it. And it's a ton of paperwork, and it is letters and notes, and it takes a lot of time as a prescriber, so it's more than a peer-to-peer, that's for sure. So was able to work with this patient on oncology and get them compassionate use. So that's a long story. I also have a short story win that I always talk about, and that I had a patient who, again, oncology. Remember, I'm allergy, so I'm dabbling outside of my normal comfort zone.
Right.
But I had a patient that had been waiting 2 months for an oral chemo, and I made one phone call to the manufacturer support program, the hub services, reviewed a few things. Hey, I'm Elizabeth. I'm patient advocate for so-and-so. She had her medication the next day. They overnighted it to her. Wow. So moments like that are huge, and it's a roller coaster in this healthcare landscape that we're in, because you've got quick wins, you've got long wins, and I have a long list of losses too. My parents are physicians. My mom's a CRNA, nurse anesthetist. My dad was an orthopedic surgeon, so we're in that background, right? And when I have a loss, it's hard because I want the doctor and I want the prescriber to make a decision with their patient for the best clinical outcomes. And when I have to come back and say, I can't get this medication, can you change it? It's not failure, but in a way, I kind of feel let down and letting the provider down because they made a choice with their patient.
Sure.
So those I chalk up to learning experiences, but hey, that's what compassionate use is there for. If you
absolutely. So let me ask you. So your niche, you specifically, is in allergy and immunology.
Correct.
I know you have expanded into the areas of oncology, which I know Jordan Johnson plays a significant role in the world of oncology. Have you found your way into the world of rheumatology?
I have. So I have done consulting in rheumatology because I go back to medication access is access, right?
Right.
We're doing the same steps, just different medications. And so I've been involved in different rheumatology practices. My consulting business actually ran PAs for a rheumatology practice for a little while. So, and I all the time default back to rheum and say, look at what happened 5-10 years ago with their medications. That's what allergy is going through now with the push to self-admin and so on. So I model a lot after rheum.
So, yeah, rheumatology, I feel so there's a lot going on. And, obviously, I spend a lot of time in the worlds of orthopedics and rheumatology. Those are two specialties that I do a lot of work in amongst some others, but those are two that I really find myself heavily engaged. And, the costs of these drugs and the access to some of these drugs is beyond the reach of these patients. I was looking at your board, and you actually have a pretty dynamic and pretty interesting makeup of your board. Um, I think I've had an opportunity, just briefly. I met Amber, if I'm not mistaken, right? Amber Epps.
Makeup off your board. Seeing 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 makeup off your board. Seeing
Well, for some reason, I am hearing a
makeup off your board. Seeing makeup off your board. Seeing makeup off your board. Seeing
wow, something has happened to our audio here, where I'm hearing a repeat of something I said, which is a repeat of your board. Let me, are you still able to hear me okay?
Makeup off your board. Seeing 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 makeup off your board.
You able to hear me?
Makeup off your board.
Okay, I'm still hearing this thing in my ear, but here's what I want to ask you in closing. Some of the folks that you have working on your board are some really interesting folks, and how are you able to attract some of these high level professionals to jump right in with you and start pushing this mission forward?
Makeup off your board. Seeing 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 makeup off your board. Seeing.
All right. So such an interesting story, such an interesting organization, NAMAPA. Really excited that I'm getting an opportunity to learn more about what it is that you all have done. I hope our listeners and our viewers today have also had an opportunity to gain a good understanding or a better understanding of what it is that your organization is all about and the things that you all are achieving. For those who have stuck around with us till the very end of today, I apologize for the moment that we had with some technical issues of our stream on the audio portion, but I hope that it got completely resolved. And again, as always, Elizabeth, thank you so much for tuning in with me today and hanging out for just a little while and letting everybody know about your organization. Again, for all of you that joined us today, thank you so much for once again taking time out of what I know is an extremely busy schedule to tune in, log on, and hang out with me and my special guest. Until next time, I'm Sean Weiss, and on behalf of the entire Compliance Guy Live crew, thank you so much. Remember, take care of yourself, but more importantly, be good to each other.